Hello, my name is Laura Cruz, and I am a state health insurance assistance counselor in Connecticut. And today I would like to share information with soon-to-be Medicare beneficiaries, the problems that may arise if you are currently employed and you have what's called a high deductible health plan along with a health savings account. So, what is an HSA or health savings account? HSAs are types of savings accounts for people with high deductible healthcare plans, and the monies, or also known as funds, that are contributed are on a pre tax basis and continue to be pre taxed when used towards qualified medical expenses. It's normally your employer who holds this, but it could be your employer or a bank account, a credit union that typically oversees your health savings account. Now, these types of HSAs are becoming widely popular with employers because it helps lower their premiums as long as your premiums. And what's great about these is HSAs don't have a use it or lose it feature. Typically, the funds that you have in there that you're contributing to will continue to roll over each year. And the monies contributed are on a tax-free basis. But if you're becoming Medicare eligible, it is very, very important to understand how enrolling in Medicare affects you. IRS defines HSA eligibility as follows. You have to be covered under a high deductible health plan. You cannot have any other health care coverage. You are not enrolled in Medicare, so that's the key words for you right there. And you cannot be claimed as a dependent on someone else's tax return. Typically, as a state health insurance assistance counselor, I usually counsel individuals who are going to be working past the age of 65 to just go ahead and enroll into Medicare Part A only, because your employer group health plan coverage would remain primary if there's 20 or more employees. Why do I tell people this? Well, one, it gets your foot in the door with Social Security. It makes it easier when you have to sign up for the other pieces of Medicare once you stop working. But if you have less than 20 employees at your place of employment, you have to enroll into Medicare Parts A and B because by policy, Medicare is primary for groups of employees that have less than 20 employees. Unfortunately, if you don't enroll into Medicare Parts A and B, with less than 20 employees and try to enroll at a later time, you are going to face perhaps lifetime late enrollment premium penalties when it comes to enrolling. So I hope you had the opportunity to listen to the other sessions that dealt with Medicare eligibility and enrollment. So the 20 or more employee mark is familiar to you. But let's take a step back here for a second. And while I would normally tell somebody to go ahead and enroll in Medicare Part A, I have to ask the additional question. Are you contributing to a health savings account? And if the answer is yes, then I'm going to tell you, along with any other SHIP counselor, that a person who is enrolled in a high deductible health plan along with an HSA and making contributions, and even though there's more than 20 employees, you should not enroll into Medicare Parts A or B, and you should not even be collecting Social Security benefits. So let's discuss that just a little bit further. If you claim Social Security benefits anytime after age 65, it triggers what's called an automatic retroactive Medicare Part A enrollment, and you cannot decline that. So it means if you start collecting Social Security is going to automatically enroll you in Medicare Part A as up to 6 months or so, depending on when you became Part A eligible. So to avoid these IRS tax penalties, you need to go to your Human Resources Department and request that your contributions stop anywhere between 1 to 7 months prior to enrolling into Medicare Part A and collecting Social Security benefits. Let's take a look at two different examples that I have for individuals who are currently working. The other example is someone who will retire, but this is an example of someone who's currently working, is now going to claim Social Security benefits, but still wants to continue to work. So here is an example of John. He has a high deductible health plan through his employer, and he's contributing to an HSA. He's going to start claiming his Social Security benefits when he turns 68 in May. And you can see at the bottom at the screen, May is in a green highlighted box here, so it's a placeholder. But he still wants to work, even though he's going to start collecting Social Security. Well, since John is going to start taking Social Security, but he's already past the age of 65, he's going to have an automatic Part A retroactive enrollment at least 6 months prior. That's the maximum a retroactive Part A enrollment can happen. So John needs to contact his Human Resources Department at least 7 months prior to his Part A coverage that will begin. So you can see that John needs to contact the Human Resources Department in October, tell Human Resources to stop contributions because his Medicare Part A will actually be retroactive to November. If he chooses not to inform his Human Resources Department that he's going to take Social Security, John is going to face an IRS tax penalty. Why? Because he's still going to be contributing right up until possibly May or more, but his Part A coverage is going to begin in November. And unfortunately, IRS rules say that can't happen. Now, let's take another example of someone who is actually going to retire from place of employment, and he is contributing to an HSA. So Harry's going to retire in November because he's going to celebrate his 69th birthday. So what a way to celebrate it by retiring. But unfortunately, he is going to lose his active employer group health plan coverage along with his HSA contributions. Because he was not working and he did not claim Social Security benefits prior or enroll into Medicare, he needs to contact his Human Resources office in June to stop his HSA contributions. So again, he will be subjected to that IRS tax penalty during that 6-month retroactive Part A enrollment. Now, John also has to use his special enrollment period to enroll in both Medicare Parts A and B. He definitely wants to think about enrolling in a Part D plan as well. So therefore, when he does retire and he loses his health insurance plan through his employer group health plan, he's going to have immediate coverage for Medicare Parts A and Part B. But he cannot go 63 days without a drug plan. So time is of the essence when someone is using their special enrollment period to enroll in Medicare Parts A and B. But key points here is he cannot go 63 days without enrolling into a prescription drug plan. Now, the consequences, the takeaways of this information is, unfortunately, Medicare beneficiaries will face IRS tax penalties if they do not stop contributions to their HSA in a timely manner. The other part is you have absolutely no recourse to appeal these penalties after they've been imposed. So the takeaway to this short little presentation is you have to know the effects of enrolling into Medicare if you have an HSA account and you're still contributing to them, and as well as collecting Social Security benefits because it does trigger that retroactive Part A enrollment. Now, you have plenty of resources at your tips. One, like I said, I'm from a state health insurance assistance program, and depending on where you are in the United States, you have access to individuals like myself, and you can find them by going to shiphelp.org. But you have many other entities that can find this information out for you as well. And those are our partners through the National Council on Aging, the Center for Medicare Advocacy. Of course, you have Medicare Interactive and the IRS website itself. And you can also speak with your trusted tax professional. If you want more individualized counseling and assistance with your Medicare coverage and choices, again, please contact your state health insurance assistance program. You can find that by going to shiphelp.org to find your state health insurance assistance program. And with that, I'm so happy you have taken the opportunity to listen to this presentation, and I hope you enjoy the rest of the conference. Thank you and have a great day.